even know that there are some condition in women that could affect the outcome of their pregnancy even before they get pregnant? These conditions are there, be it medical conditions, social condition, and they can affect the outcome of the pregnancy. Welcome once again to our channel. My name is Dr. Adeniro. I'm a consultant obstetrician and gynecologist, and on this channel we discuss about women, our health, and our unborn child. And for the topic of today, we'll be discussing preconceptional care. Before conception, pregnancy, care, as taking care of one's health. So preconceptional care is that care that is given to women before she gets pregnant in order to know things that could militate against delivery of healthy baby to a happy mother. So if you are yet to subscribe to our channel, kindly do, and ensure you like our videos and share. Thank you for staying tuned. Okay, preconceptional care is the care of a woman before she gets pregnant. A woman, of course, a woman of reproductive age, before she gets pregnant, in order to identify and prevent things in her, like both social things or medical things in her that could bring about that could be against our aim of having our aim, which is having safe delivery of healthy baby to happy mother, and of course happy family in all. So that is preconceptional care. You agreed with me that there are conditions in a lot of people that will remain in pregnancy or even get worsened because of pregnancy, and this condition may mean that there could be bad outcome, like baby being dead and the mother even being dead, or even if she's not going to die, she's going to have a lot of complications because of the conditions that are even there before she gets pregnant. So it is very important to identify this condition prior to pregnancy, and preferably nothing less than 3 months before pregnancy. And of course, after identifying, if it is possible to prevent them from coming up again, or better still to treat them in order to have good outcome. Now, some examples of this condition include a woman that has hypertension. There are different types of hypertension, those that come up only in pregnancy, and we have those people with hypertension even without being pregnant. So that means this group of people should be identified on time and appropriately taken care of before pregnancy. Or another group of patients include patients like sickle cell disease patients. We already know some of the problems associated with sickle cell disease, and we can't lie to you that pregnancy is very, very dangerous, very stressful on a sickle cell patient. So that means such patients should be seen before she gets pregnant in order to maximize the outcome of the pregnancy. Other important medical condition is diabetic patient. A known diabetic patient should be seen. Other conditions like epilepsy, these conditions are not going to debar them from getting pregnant. So what do? You identify them, you prevent all these conditions, and optimize them before they get pregnant to have very good outcome to both the mother and the baby. Now, other conditions, or this condition may not be common in our environment, like an adolescent or even young people taking illicit drug, alcohol. Some people are even on drugs, on kind of drugs that they are recommended in hospital. They have been prescribed in the hospital. These drugs, one should not get pregnant while taking these drugs. So this group of people, they require preconceptional care. So what do we do in preconceptional care? We say this group of women, if you know there is any of this condition or some other condition that are present, you have to visit the hospital to be seen, preferably like 3 months before you attempt to get pregnant. Now, their history is going to be taken, like interaction, to determine the extent of this condition, or better still, to even diagnose how severe these conditions are, and subsequently they will be able to classify how the patient is and give the proper care to such patient. Now, this is the part of clerking. During this visit also, your health professionals are going to examine, do thorough examination from head to toe to pick any condition, maybe as a sequelae or a complication of the conditions we are talking about, or even another thing that the person may not even be aware that is present in her that could actually worsen during the course of pregnancy or militate against safe motherhood. So because of this, examination is a cogent part of this care. Other things include, there are some tests that you may need to do. You may need to do some tests, to do some basic tests. Apart from knowing what those conditions are, these tests are also going to be like baseline, whereby if there is going to be any subsequent deterioration or like change in the result of this test, we can actually compare to the baseline results that we already have in order to really know how the conditions are going. Now, the last part of it is that after this test, there are some other things that will be done, like we call them all together like treat this particular condition. Do you need drug? Do you need some corrective surgeries? All this may have to be done even before the pregnancy comes up. So now let's take it one after the other. In the history, the interaction with the patient, for example, we may be able to tell if a sickle cell disease patient is having a frequent crisis, and when there's frequent crisis, we may need to do a particular counseling to really determine when it is suitable for the patient to get pregnant. Other things include things like she has had in the past, even in the outcome of previous pregnancies that could tell how this intending pregnancy could go, how far it could go, or how bad it could become. So because of this, history of previous delivery, has she had any surgery before, or a diabetic patient, is there any things in the history that will tell us that has involved other systems, even beyond the common system that the organ affect. Like we say, like a hypertensive patient, we know majorly it could affect the heart. Few people we know that it could affect the kidney, the vision, the eyes. So because of this, detailed examination will have to be done, and before this examination, detailed counseling to interact properly, asking 1 or 2 questions. Like a sickle cell disease patient should actually know the PCV, which is the packed cell, the volume of blood that she normally has even before pregnancy, because in pregnancy automatically this blood volume will come down, but we can know even before pregnancy this value and appropriately monitor her in pregnancy. And on examination too, this may call for like a multidisciplinary approach, whereby apart from the obstetrician seeing this patient, it may be need to like dietitian, like internal medicine physicians, like cardiologists, renal physicians. They may need to see among other disciplines in order to have all hands on deck to have good outcome in the pregnancy. So because of this, at this visit, multidisciplinary approach is going to be used, whereby everybody is going to be present with the aim of optimizing the woman pre-pregnancy, and even subsequently when she gets pregnant, she's going to have a very good outcome. And of course, some of these tests are also very important because they are going to be done. For example, now you really want to test how bad the vision of a diabetic patient is, how functional is the heart, how deteriorated is a kidney function in a woman that's had maybe a previous previous transplant before. These are conditions that they should come to the hospital. And a person also on some drugs, like an epileptic patient on some of their drugs could bring about malformations in the baby. So because of this, you really want to talk to them, know the kind of drug they use, do some tests to know how bad they are, and subsequently under the treatment you will need to like remove some drugs, replace those drugs with ones that are safer with pregnancy. In pregnancy you replace them, so it gives better outcome rather than having drugs that could bring about malformation, miscarriage. So they are going to be removed. Other thing them on folic acid. It is said that folic acid should be in the system well enough, like 3 months before pregnancy. So these women may have to be on folic acid, and in fact there are some group of women that require more doses, higher doses of folic acid compared to other patients. And of course this will have to be done during this preconceptional care. Other people include a woman in the past who has had delivery of like a congenitally malformed baby. You don't just take it to chance, because this could reoccur, but it is better to put some things in measure that will reduce this risk, and this will be done during preconceptional care. Now at the end of this, then the woman can be optimized when she gets pregnant. The outcome of the pregnancy will be very sure that there won't be unnecessary intervention of the condition on the outcome of the pregnancy. And subsequently with pregnancy, we encourage her to register on time. And with this, we have been able to tell us that preconceptional care is very necessary for some group of women. And during this time, interaction, examination, some tests, and some prescription will have to be done for this woman in order to have a safe delivery. Kindly check the link above for our previous video where we discuss about high-risk pregnancy. So at the end of this, kindly subscribe, share, and like our post. Thank you for joining us.